Insecurity about hair loss is a big issue for men, but not just men, it also affects women.
That's right, and it doesn't have to be. We headed to the Vein and Skincare Center of Hawaii to learn about the latest treatment options. Well, who doesn't want to have a luscious head of hair? It goes for men and for women. And there are some new treatments that we want to tell you about. We're here with Dr. Woody Chung at the Vein and Skin Center of Hawaii. Tell me about this PRP treatment.
Well, PRP is short for platelet-rich plasma, and what we do is we draw your own blood, and we use a centrifuge and separate out the platelets from the red blood cells, and then we inject the platelets back into the scalp. And what that has in there, all the platelets, they do have growth factors, and there are about 7 that are really strictly, particular for the hair stem cells, and then they cause the hair stem cells to grow. So it ends up being that your hair gets more denser, more thicker, more healthier, and allows the patients to do treatments that are non-surgical.
And how exactly does that work? It sounds like you hear a lot of medical things, but when you see the pictures, that's what's going to sell most people on it.
Yes, exactly. So what we do is we recommend patients getting about 6 treatments for the first year of treatment. We do ramp it up in the first 4 months, so patients will be coming back every month and getting an injection of their own PRP, or platelet-rich plasma. And what that does is it starts stimulating the hair to start growing. The hair has 3 different growth cycles, and so we want to hit it in that growth phase. And so once the 4 months are done, then we kind of break it up to once every 3 months. And then the second year, it will depend upon the patient's density and how well they responded. And we usually recommend about 3 sessions for the second year and as maintenance.
Now, people are going to wonder, does it hurt?
There's a little pinch. We do use this very small needle, but we also have a Zimmer cooler. It's a chilling device which kind of gives a little bit of anesthesia at the site of injection, and it does seem to help a lot. We've been treating quite a bit of patients so far, and we're pretty much done within 2 to 3 minutes.
Wow, that's very quick. And how is the new treatment compared to the old one?
Well, the treatment process is the same. I mean, the schedule's the same, the injections are the same. However, what we did was we upgraded to a new device, or a centrifuge. So we're able to have more high density in the platelets and of the platelets from the blood, and so we're able to get more volume, and so in turn the patients will be getting more of their own platelets, and in turn hopefully more growth factors, and then the end result would be a lot better result.
And can this be applied to other parts of the body that you might want different results for?
Yes, we were using it for skin rejuvenation. We still do, and that seems to, after laser, after microneedling, any type of treatment to improve the skin, the PRP does help a lot, and it stimulates your own collagen and your own body to, give you more rejuvenation, basically.
All right, everyone needs that. Dr. Woody Chung, I'm sure people come and say, can we have the hair just like yours?
Yeah, well,
is that part of the option plan?
Well, we definitely would like patients to, get the results that they can achieve, and so we, recommend vitamins, and we also recommend some other medication for the male patients. And yes, I don't get PRP injections, but I do use Nutrafol, which is a male vitamin, and it seems to be helping.
All right, more advice from him. If you don't have the genetics, there's a lot of treatments that can help. Thank you for inviting us over to check it out.
Thank you for coming by.
I mean, the before and after pictures really tell the story.
And that's really all that anybody really cares about, to see that and to know that it works like that. There you have it.
And the improvements all the time. If anyone's worried about pain and this type of thing, they're improving all the time. So it's such a sensitive subject to deal with thinning hair or bald hair.
Plus, Doc is awesome.
Yeah.
I mean, they do a lot of stuff there, and he is so good with his patients. We've actually sat in on a couple of procedures, and it's just, and in fact, you can see some of those on our website. Go to k212.com, go to the Living at Weight, and just follow the links. But he's just great.